Welcome to Local Doctors on Call. I'm Suzanne Lee. Tonight we are coming to you live from our SNN studios in Sarasota. We're joined by two doctors from East West College of Medicine on Tamiami Trail in Sarasota. We are joined by Dr. Dwayne Boggess and Dr. Stephen Wrench, each bringing a unique set of experiences to our studio. Dr. Boggess, let's share a little bit of your experience. Welcome to both of you.
Thank you.
Thank you for having us.
So tell us a little bit about yourself, Doctor.
Well, I've been in the medical field since 2007. I started as a licensed massage therapist, and I got into acupuncture a little over 4 years ago.
So your official title is?
I'm a doctor of Oriental medicine.
All right, and Dr. Wrench?
Well, I started martial arts in 1965 under the tutelage of my older brother. And through that vehicle over the decades, I was able to see a great deal of Oriental medicine and acupuncture, and I was somewhat puzzled by it. And then in 1970, I was in the northeast section of Saigon as a young sergeant in the military, and I struck up a dialogue with a Chinese missionary who was doing acupuncture on local villagers, treating them for malaria. And seeing it again, it was almost like a seed was planted. And so years later, that would lead me to East West College of Natural Medicine, where I would return years later as the clinic dean.
So tell me about this. What is East West College of Medicine? Either one of you can take it.
Well, it's been in Sarasota for 20 years, and we train acupuncture physicians, doctors of Oriental medicine, and we use an East-West combination of medicine. So it's a Western and an Eastern approach to healing.
Many of our viewers are not sure what Oriental medicine is, so why don't you go ahead and tell us a little bit about that, Doctor?
Oriental medicine it's a combination of different modalities that started a little over 3,000 years ago. And it stood the test of time as far as different aspects and how to approach the body and how to see different things in diagnostic methods as far as how the bodies respond to stress, trauma, what actually is going on from a root cause perspective into more of a superficial perspective. So how would you elaborate on...
Well, when we think of Oriental medicine, we think largely, or at least I think people in general think acupuncture. And when you think
Right.
of that, they think of putting needles in the body.
Right.
But it's a whole lot more than that. And as we said, our approach is Eastern and Western. There's a trend today to label medicine that isn't Western-based as alternative, and we talked about this in our commercial, integrative, holistic, functional. We like to think of medicine, as we said, as it's just medicine. It's not us and them, it's just us as a collective. And so we use what's best for us from Western, and certainly the acupuncture and all that goes with it, including we have some examples of herbs that we use. Old expression in ancient Chinese medicine is acupuncture walks on two legs, acupuncture and herbal medicine.
So let's talk about this in just 1 second. I want to include our viewers in this. 361-4675 is our number. What I want our viewers to know is that this is a live local call-in show, and you are welcome to join us if you have questions. Tonight's focus really is going to be about chronic pain. We will focus on your issues. You can feel free to share those with us. Again, it's 361-4675. So go ahead and tell us a little bit about what you have here in front of us.
Yeah, well, what we have here is just a little demonstration of what the acupuncture needle looks like compared to some normal things that we have. As far as, I don't know if you can zoom in on that right there, but we have just an acupuncture needle compared to a thumbtack, a paper clip, a match, and a bobby pin.
So this is the needle right here, the acupuncture needle right here.
Correct.
That's
Okay.
it. It's very hard to see because it's tiny. It's the size of a human hair. So compared to the rest of these, it's really small. And a lot of people, they come to us and they're afraid because they think that the needles are going to hurt because they're used to getting injections, they're used to getting their blood drawn. But in fact, these needles are so tiny that a lot of times they're not even felt. So just to give you a perspective.
The type of needle that we use, Suzanne, is called a filiform, and that means hair-like structure. So I can show you one of these, and I'm sure our camera won't pick this up, but I want you to see it. If I just pluck this, and maybe you can see it against my lab coat, but
Right.
it vibrates. Literally, it's the thickness of a hair, and I could tie this in a knot if you can see that.
Can I touch it?
You may,
Can I
just be
feel it?
careful
It's
for the
really
point.
sharp on the end there.
Okay. Oh, that is really fine.
It's unbelievable. So
Yeah.
when we say, we talk about acupuncture, it literally is painless.
Can I see that? I just want to hold that up so the viewers can see.
Give you-
So this.
Give you your own here.
Oh, my new
I'm
one.
going to want
Okay.
that back
This is
after
my
the
own.
show, by the
So
way.
which, okay, I'm going to
Hold the
focus on
camera.
this one right here. So this is the actual needle right here. So this is why they told me to put on hand cream a few minutes
the way,
ago.
we can
Because
pass-
they knew this was going to happen before I did.
Earlier today, we took a hypodermic syringe and we passed 3 or 4 of these through the actual hollow needle of a hypodermic syringe. So for people that haven't experienced acupuncture before, we just want you to understand it isn't painful, and it shouldn't be. So this is, go ahead.
No, I just wanted to have you focus a little bit on, say, tennis elbow. How would this be used to alleviate some chronic pain in a tennis elbow? What would happen?
Why don't we find out with your elbow, since I understand you haven't had
Are you,
acupuncture before.
are you sure you're okay with me doing this?
Well, I'm okay. Are you okay receiving it?
Sure. Do we want to come around this side? What should we do?
No, well, you're good right where you are. I'm just going to use a real common point here
Okay.
that we would use in tennis elbow, and that's a little alcohol swab for our audience. And then I'm just going to ask you to fold your arm and just
Do I
kind
want to
of keep
look
it
away
right
as
there.
I used
You
to?
can look.
And
It's
breathe
not-
deeply?
Yeah, and
Breathe deeply.
I'm going to place this here, and I'm just holding the guide tube. I'm going to free the needle up with a little twist, give it a tap, give it a gentle insertion, and if you can see that against my hand,
That is not in there. That
it
is in there.
absolutely
You're
is
seeing
in
it.
there.
It's
Oh yeah, I know. I feel nothing. There's
Okay.
nothing.
And it's literally quite that simple.
Thank
And
you.
so, now you could say you had your
I have
first
it.
official
But how does this
acupuncture
work?
treatment.
Describe what is going on inside my skin and the muscles with this.
Okay, well, first of all, we're not exactly positive about how acupuncture was discovered. And the reason is the printing press didn't come about until the 1400s. But what we do know is that when we hurt, we always pay attention to it. If I have tennis elbow, and I actually do, and I'm doing this today, wow. It's like you can't leave the area alone.
It's an ache.
So we
You're feeling an
believe,
ache.
or surmised over centuries, that paying attention to painful areas or trigger points, if you will, on the body, right, was the beginning of acupuncture by massaging or kneading these points. And over time, the Chinese physicians of their day began to link the body by connecting these tender points on the body and created what we call the meridian system. Now, we call them channels or meridians. Think of them as little passageways through the body, much like the wiring that runs through a home. And so what the acupuncture points are, and a simple analogy might be like the keys on a computer keyboard, that if we push this particular key, this will come up on the screen. And if we punch several keys, we can activate this particular program. So what we do is by triggering certain points on the body, we generate responses in the body. We gently coerce your body's healing energy to do what it already knows how to do, and that is repair itself.
How is it repairing itself? Is it blood flow? What is happening here?
Well, what we're doing is we're bringing attention to that area with the acupuncture needles. So the brain's response to that reaction is what releases those things that the body needs to acknowledge. Hey, look, we need to show some attention to this area. So
To demystify a little bit too, we use a term in Oriental medicine. We want to stay away from what we call mystical dragons
Sure.
tonight. But we've all heard of qi, as in Tai Chi or Qigong.
Energy?
Energy. It's simply healing energy. It's life force. Everything that's living has qi. Western science doesn't use the term qi, but they recognize that there's a motive force. It's called EMF, electromotive force, that keeps our heart beating, lymph flows through our lymphatic system, blood flows through our circulatory system, right? This keeps our body enervated and animated. Now, when energy is blocked in the body, the end result is always generally pain and ultimately, over long term, disease. So as long as we keep energy moving the way it's supposed to, it's kind of like the interstate. If the traffic's moving, everybody's happy.
Yes.
When it blocks up, it becomes congested.
And that
there's
is
always a
happening in our
problem.
body.
Exactly.
We are getting ready to go to a break, but before we do, I want to remind our viewers, we are 361-4675 is our telephone number. Feel free to give us a call. We are talking with 2 doctors here, Dr. Stephen Wrench and Dr. Dwayne Bogus from East West College of Medicine, and we'll take your calls if you're dealing with chronic pain live here on SNN. We'll be right back. Welcome back to Local Doctors on Call. I'm Suzanne Lee. We are focusing on chronic pain with Dr. Stephen Wrench and Dr. Dwayne Bogus from East West College of Medicine. One of the areas of chronic pain, your back. Tell us a
low
little bit
back.
about what's going on here.
Well, Suzanne, 80% of all Americans are going to experience back pain sometime in their life. One of the misconceptions about acupuncture is that primarily what we treat is back pain. That's not true. We treat a great deal of pain because most everybody has pain. But this is
I
certainly...
agree. Honestly, I know a lot of people that are suffering from one thing or another.
Well, certainly this is an area that affects almost all of us. So what we thought we'd do is just demonstrate a few simple points. On either side of the spine here, we have a series of points that we call the shoe points, or transporting points. And we won't go into a great deal of detail about it, but these are some of the keys on the keyboard we talked about.
So these are very important areas of transmitting energy through our bodies, what you're
That's
trying
correct.
to say.
And so while we talked to Chris earlier that a lot of his area of concern is his low back, I think we're just going to give a little gentle demonstration. And this will also be his first experience with acupuncture. Is that correct, Chris?
You want me to hold your hand? And it's really
comfort.
amazing. It just doesn't hurt at all.
Okay.
You can not tell a
And we're just
thing.
going to be sure where we are. And we're
Now you're
gonna-
going in from a little angle there,
We
which is
are,
interesting.
because we're a little concerned about his lungs.
Okay.
And so we certainly don't want a pneumothorax on television, so we're not going to,
Okay, what's it?
nor does Chris, for that matter, so.
So you're coming in from an angle on his back a little differently than you did on my arm for that reason.
That's correct. That was
right.
what we call a perpendicular insertion.
Okay.
These are transporting points that have a direct effect on all the internal organ systems. So as we said, the wiring of the body by way of meridians is kind of like the wiring in a house.
You guys didn't put any in yet?
They're in. Yes, they're in there.
Yeah, they are.
And are you
promise you.
specifically going so many inches apart for a reason? Tell me about that.
These points that we're using that are called transporting points are what we call 1.5 sun. That's a measurement based on your own body's measurement on either side of the lower border of the spinous process of all of the vertebral bodies along the spine. And so that's what we're doing. And you can see that he's experiencing no real discomfort at all.
No.
But when we stimulate these points, we're really communicating with the interior of the body. Just the way, even as Dwayne would tell you, in a massage. That's why if when you get off a massage table, you feel so good. When a treatment is over in acupuncture, most people are in kind of a euphoric state. And they generally say that they almost feel like, to quote patients, that I had a cocktail or two. That's
Well-
what they feel like. Because when we're stress-free, right, we feel really good. And when we have pain, we always have stress. So if we can lower one, we can lower the other.
361-4675 is our number if you would like to have a question answered about what we're doing right now, acupuncture on Chris's back. He's very generous
So you
to let
feel
us use his
anything
back
yet?
on television. This is wonderful. And the reason, again, we are doing this is to alleviate pain in Chris's back.
That's correct.
Lower pain for him specifically, or are you doing this upper area for a different reason?
This would be more of like a tonification treatment for him, just to kind of relax and just kind of communicate with his interior. If we were treating his low back, we would work some points at distal locations, but other points in the area that he expressed earlier were his areas of concern.
And tell me about when you said a little bit of, did you say manipulation? Are you going to turn those, or what are you going to do
we
with
would
those?
turn him. You can see already around the needles, he has a pretty obvious response where there's a little redness around the needle.
Yes,
It's a good chain reaction.
It's a good reaction.
it is.
Yes. So this is that healing energy is arriving at the needles. And again, I don't want to get too mystical with all this, but basically this is a really positive response, and we look for this in the treatment, so on.
So a lot of people are suffering from chronic pain, but maybe afraid to try this. Why do you think they should try? Give us an example of some of your experiences.
Well, number one, it gets them away from how do we treat pain by and large in this country? We medicate it away. And what happens is the problem still exists, but we no longer feel the pain until the medications wear off. So this is a natural way. It's an alternative way. It's the oldest way on the planet. And again, it's not us and them. It's just that this is what we use in conjunction with Western approaches to medicine. So we might use, as we talked about earlier, laser therapy, which we brought. We might use acupuncture point injection therapy. We might do herbology. We might do the application of topical liniments and plasters and herbs and so on.
Now, is he okay to stay here like this while we take a call? Is that bad? If we
No,
ask
it's
him to
fine.
sit here? Okay.
Treatment's
So
ongoing.
we have Mike on the line. Mike, you are on Local Doctors on Call. Thank you for joining us, Mike. What's your question?
Hello.
Hi, Mike. Can you hear us?
Yes, I can hear you.
What is your question for the doctors?
I just want to know, like, with that, with the acupuncture, is it something that's a one-time deal, or does it depend on the injury, or is it something I have to do multiple sessions with?
It's a good question. Thank you,
Well,
Mike.
You mind if we get this one?
Go ahead.
It depends, Mike. First of all, the factors that affect success or healing of any treatment in any modality of medicine are the age of the patient, number one. Number two, the longevity. How long have you had this particular problem? Number three, how severe is this problem? Number four, any treatments you're having now that maybe are or are not helping, they're not working for us in a positive way. Next factor would be our experience, our diagnosis, our treatment plan, and lastly, your willingness to follow our treatment plan, your patient compliance.
Did we answer your question, Mike? I hope we did. Thank you so much for calling. 361-4675 is our number if you would like to have your question answered. I have a question now about what is going on here. Now, some are not all red. You have some higher areas of redness, and then this area not very much at all. What does that mean? Did I stump you?
No.
Okay, just checking.
The reaction is different for everyone and for every region that you're treating. So this might tell us that this area here needs more focus and that this isn't really as activated or as much of a problem.
Do you have more pain on one side than the other?
It's like the middle to lower. It's like the muscles are tense and they're warm. It's like a dull.
Kind of a dull, heavy
A
feeling.
dull pain.
Yeah.
Exactly.
What you would normally experience when needles are first inserted. It depends on who you ask, but we want a response from the needle, whether we get a redness or we get a response from the patient. Some people say it feels like an electrical current, a tingling, if you will, a heaviness, maybe a heat sensation.
It is a heat sensation.
And in
warming
this
up.
case, we want that because it means that the body is starting to respond. As these points, remember they're keys on the keyboard, as they're pressed, we're getting a response. So no response, while it's not a non-functional effect, we want some response, certainly, and we're getting one. So
Now, we're going to
happy
take a
with
break here in just a minute. Does he need to stay like this for a certain period of time?
that. About a month, and then we're going to cut him right off. No, we're good, we're good.
All right. So we are getting ready to take our break, and when we come back, we'll focus more on what you have in the jars. They look rather interesting to me. We are asking for your phone calls if you are suffering from chronic pain for one of the doctors here from East West College of Medicine. Our number is 361-4675. We'll be right back. Welcome back to Local Doctors on Call. We are joined by Dr. Wrench and Dr. Bogus from East West College of Medicine. We have Beth on the phone dealing with chronic pain. Hi, Beth. Welcome to SNN Doctors on Call.
Hi.
What's your question for the doctors, Beth?
My question is whether something like this would help with nerve pain due to an amputation above the knee.
It's a very good question. Did you hear that? Okay, guys?
Nerve pain above the
Nerve pain above the knee from an amputation. Thank you, Beth.
With this?
Actually, yes, it will, Beth. That will help. There's acupuncture points that we can use to stimulate those areas to calm those nerves down. So when they're flared up, when they're aggravated, obviously that's when you're feeling them. And acupuncture can calm the nervous system down and kind of turn the volume down on the nervous response to that aggravation. Does that answer your question?
Yes, how do I follow up with this?
Well, may I ask, when was the amputation?
The amputation was in February 2011.
Okay.
2012.
And are you still suffering from pain, Beth?
Oh, yeah.
Yeah.
You know what we'd advise you to do at this juncture, Beth, is to call the clinic and schedule a consultation, and we'll talk a whole lot more, all right?
Why don't you go ahead and give that number for everyone?
It's 941-355-9080.
Okay. And we'll talk more, and we'll give that number once again at the end. So while we have a few minutes left here, the doctors are actually going to be working on Chris with a laser. Now, doctors, go ahead and tell us what this is and why this could help Chris's back.
Okay, what this is, Suzanne, this is called an ML830. It stands for microlight, meaning it's a portable version of a laser. This is a low-level energy, handheld, non-invasive, what's called athermal. It means it's a cold laser. In other words, it generates no heat. This laser penetrates into the tissue about 5 centimeters, and the light is absorbed by the cell's mitochondria, which is what we call the cell's powerhouse.
The energy. They're the energy.
Correct.
Cell,
And
part of
the cell simply really loves the light. So what happens is the cells are bathed in the light. This communicates with the mitochondria, which amps up its own metabolism. What happens is lymphatic flow increases, vasodilation increases, the vessels get larger, bringing more nutrient-rich blood to the region, and it communicates directly with the central nervous system. In other words, the cells simply love it. It creates an anti-inflammatory and ultimately an analgesic effect. So what we're going to do is, I'm going to turn this on. Of course, we don't want to look at the laser. I'm going to use Dr. Bogus's hand, and perhaps you can see the red light there. And do we have it there? Oh, sorry, it's not supposed to burn. It
doesn't.
Little medical humor there. There's very little humor, isn't there? So we're going to do this, and I'm going to place this right on Chris's back and just turn this on. We hear it giving off a little audible beep, tells us it's working, and we're using what is 3 joules of energy. This is a 30 milliwatt current that he's feeling. 30 milliwatts of continuous wave laser energy.
Equivalent to what? I mean, put that in terms that,
Well, joules,
I
it's
can
hard to
understand.
explain. Joules are measurements of laser energy.
Okay.
But this is a portable unit, and why we brought this is because it is portable. We can bring it. If we had a larger unit, we wouldn't probably be able to bring it here today. So we're going to run a 30-second cycle. And every time we do this, we're going to rotate the laser just a little bit like this so that we're bathing the cells in the area in question in this healing laser energy light. This has been used, by the way, for 20 years. And lasers go back a lot longer, but as a medical therapeutic device, about 20 years.
So tell me about some of the successes that you have seen using this device.
Mr. Dr. Bogus, get this?
Well, the laser it can also activate the acupuncture points that we would look for with a needle, but with the stimulation from the laser, we can get the same response.
Especially when you have people that have an aversion to needles.
Right. It's
So
a good
this is
alternative.
literally a type of, if you will, needle-less acupuncture, especially for children or people that are super sensitive. While we say needles don't hurt, everybody feels things differently.
So in either or situation, not both, would you ever use it together?
All the time.
Oh, okay.
We do a great deal of, in fact, today, all day long, we were using laser in conjunction as an adjunct for chronic and acute pain with acupuncture patients.
Now, how does insurance recognize some of these things? Do you find that they do or they don't, or what are some of your experiences with insurance these days?
A lot of times it depends on what insurance package you have. Some of the higher level packages will cover acupuncture. For the most part, it's coming along.
It is, right?
Right.
I've realized that.
More insurance companies are starting to cover acupuncture. It's more recognized. So
don't assume that your insurance company will not cover it.
yeah,
Make the
don't
call.
assume. We need to get the call them up, see if it's covered in your package. That's important to find out, first of all.
Now, how long will you be working on his back if we were in your office? What would your procedure be?
Well, again, it would depend on the longevity of the problem and the severity of that problem. But probably for him tonight, we would just do 5 or 6 minutes of laser therapy.
Okay.
And we would then we could move on to something else, but we also do this a great deal in conjunction with acupuncture point injection therapy, which is, we use a lot of homeopathic because there are no side effects. When we watch commercials today, we see that everything that we ingest just about has a side effect. And so with homeopathic injections, we use these a great deal. These are made of botanicals and minerals, so there are virtually no side effects to these.
You know, millions of people are suffering from chronic pain every day, and I think with the addictions to pain medicines, people are afraid now to go to get just a prescription for anything. I think they're getting a little leery, at least my friends are. And maybe a more natural approach is sort of something that they might want to look into. Do you find that you have experience with people who may be afraid of medicine, pain medicine?
We do. We get that
Great
a lot. The majority of our patients come to us because they don't want to take medications. They're looking for alternative. So alternative medicine really does play a big role there. As far as pain medications that are out there, a good example is like OxyContin.
Perfect example.
That's very common. Everybody knows that name. But the body actually produces oxytocin.
Put a little bit more back.
Which is a pleasure, is it a...
Well, it's a pain blocker. So it's a natural pain blocker that our own hormones can generate. So what we're doing with acupuncture, when we're stimulating those acupuncture points, the nervous system is recognizing those points, and it creates the natural effect of oxytocin, which helps the body cope with pain. And when we take a lot of those pain medications, you get addicted to them. Well, what it does, every time you take a pain medication, your body says, well, we don't have to create our own oxytocin. We don't have to create our own pain relievers.
Because it's falsely being created for you?
Because it's falsely being created. So we turn that off, in essence. That hormone gets shut off, and then we become addicted to a painkiller. And then the response when we try to come off that medication is that of, wow, everything's painful now. Because the body's natural reaction to kill pain is gone. So we have to retrain the body. And that's where natural medicine or acupuncture comes into play, is we're retraining the body to perform naturally, to do those pain-killing elements without any medications. So we're converting people over So in other words, those pain medications that people are taking, yeah, they're avoiding them. That's why they're coming to see us.
We have 2 minutes left in our show, and I really want people to find out more. If they want to become a student, for example, at East West College of Medicine, what would they do?
Well, give us a call. You can give us a call at the number, the 941-355-9080. And one of my hats I wear is in admissions. So you'd be talking to me. I would give you a tour and let you know what we do at the campus, what kind of training you receive, how long it takes, and the intensity of it. And also, you're going to be getting both medicines at the campus, Eastern and Western.
And Dr. Wrench, if you wanted to become a patient, what should people do?
Well, you call our number, again, 941-355-9080, and you simply ask for the clinic desk, or you can dial extension 108. And remember, a consultation costs you nothing. And 3 things we would say about acupuncture. It's painless, it's affordable, and it's effective.
Thank you so much, Dr. Stephen Wrench and Dr. Dwayne Boggess. We really appreciate that. And Chris, his 24-hour, in the next 24 hours, any reactions that he might have? Would he be sleepy? Would he need more water? What would be
He's
some
going to be very laid back.
He needs to chill, is
We're
what
going
we
to have
say
to
around
pry him out of
here.
there, probably.
Well, next month on Local Doctors on Call, we will take a look at both Eastern and Western treatments for diabetes, metabolic syndrome, and for weight management. Common? Very common?
That's one of the top things.
So
yes.
we will see you next month for this, and maybe Chris will join us as well.
Sure hope so. Thanks
on,
for
bud.
having us.
Thank you.
very much for coming in. Again, the phone number, if you'd like more information, is 355-9080. And again, 355-9080 to become a student or to also become a patient at East West College of Medicine. For Local Doctors on Call, I'm Suzanne Lee. Thanks to Chris. Thanks to Dr. Wrench and Dr. Boggess. We appreciate you all joining us, and to our callers. Have a good night.